Living with food allergies takes an amazing mental and physical toll on people, and it's not just the person who has the allergies, it's really about the whole family. And it's very important to us to give the family the treatment, the care, the support that they all need going through this.
One of the most unique things about Latitude is that it was built by families with food allergies for families with food allergies. So we just have an understanding of what the needs are of these families. We really wanted to make exceptional food allergy care accessible and available to all families living with food allergies.
We really emphasize a patient-centric experience and a patient-centric care. It's very important to us that families receive the level of care that we would want for our own families.
Other allergy clinics usually treat a variety of allergic conditions, everything from environmental allergies to asthma, in addition to food allergies. But because those environmental allergies and asthma can take up so much of their time, there may not be as much time dedicated to food allergies. Here at Latitude, we are 100% focused on food allergies and food allergies alone.
We see patients of all ages and stages, and we're here to support them whatever their needs are, whether that's early introduction of allergenic foods to infants. We also offer many food challenges to help reintroduce foods that patients may have been avoiding and may have outgrown their allergy to. We also do offer some treatment options, including oral immunotherapy, and we offer long-term follow-up for patients who may have gone through clinical trials.
The protocols that we use are evidence-based. We rely on protocols from major research institutions like Stanford and UCSF and Baylor to come up with our protocols. We do personalize them for each patient, but they are rooted in evidence-based medicine.
We really try to approach food allergies in a proactive way. And we built our clinic in a way such that we have the time to get to the truth, to really understand what are you really allergic to.
It's amazing to see a family come in here and they have a tremendous amount of anxiety, which is completely expected. And then to see as they start going through treatment, their guard comes down a little bit and they're feeling like they can start to do some things that they never did before. And I hear people say, we went to a restaurant and we'd never done that before, or we went to a trip overseas and we never thought that was possible. And so it's enabling families to have a sense of freedom when they are out and just enjoy their surroundings and their family and not have so much fear and anxiety around food and their environment.
I see these one-year-olds coming in here and they're excited and they don't have an ounce of fear yet because they don't even know that they're allergic. And I just feel like it's the most amazing gift to be able to treat these kids for their food allergies before they even know they're allergic. They will never know they're allergic. They don't have to be afraid on the playground. They don't have to avoid birthday parties.
Families are dealing with not just the underlying medical disorder of food allergy, they're dealing with all of the emotional and social aspects of that every day. And as patient care coordinators, we're able to hold hands in that regard. We've intentionally created a communal space so that families can interact with each other and learn from each other.
If you go to a typical doctor's office, people go there because they're sick. And by that design, people don't necessarily want to interact with each other. When you come in, you need to actually be relaxed.
I want them to walk into those doors and immediately feel at home. I want them to feel comfortable. I want them to feel like that communal space is just like their living room. So really just making them feel at home here, because I know that a lot of what we're doing here is trying to ease that fear and the anxiety around food allergies, and so I want this to feel like a really safe place.
I'm so excited to be able to finally give families answers and not have the confusion that I had when my children were toddlers and I didn't know, because they're allergic to one thing, does that mean I can't give them this other food? And now our guidelines have become clearer. There are treatment options. There's so much excitement in this field now, and I'm really excited to be able to offer that to younger families.
The whole reason we named Latitude what we did is because we want people to have the latitude to live a life free of worry. We want kids to have the latitude to be able to go to birthday parties and not be afraid. Beyond protecting my own child, the most rewarding is that we were able to open Latitude so that we can help so many kids. And every day it's so rewarding to see another kid dance out of here a little bit more confident, much more empowered, like, I got this.